OSHA Bloodborne Pathogen Training. What is OSHA? Congress enacted the Occupational Safety and Health Act, which created OSHA in 1970. Their mission is to help employers and employees reduce on-the-job injuries, illnesses, and deaths. 22 states opted to create their own health and safety regulations. However, Texas is federally regulated, not state regulated. They created many regulations, also known as standards, which require employees to 1. Maintain conditions and/or adopt practices necessary and appropriate to protect workers on the job. 2. Be familiar with and comply with standards applicable to their establishments. And 3. Ensure that employees have and use personal protective equipment when required for safety and health. Today we will focus on the standard of bloodborne pathogens. You may wonder if pregnancy centers are covered. In a letter written in 1993 from Judith Brown, who is the legal counsel for CareNet. Now you can read this on your own in its entirety. You should have a copy, but it does talk about the handling of urine. Quote, OSHA's jurisdiction extends only to the safety and health of employees in the workplace and does not extend to volunteers or to the general public. However, public quotation. However, PRCE wants to go above and beyond and extend it to our volunteers. If you read with me on the 5th paragraph, it says this, and this is the OSHA replying to Judith. Your letter indicates that you anticipate that in certain percentage of cases, employees will be exposed to urine that is contaminated with blood. You correctly note that although urine is not generally considered an infectious material, any body fluid that is visibly contaminated with blood, including urine, is included within the definition of OPIM. Therefore, the reasonable anticipation of worker exposure to urine contaminated with blood would require full compliance with the standards requirements as would any other occupational exposure. If the center employees are required to perform the test and/or dispose of the urine. So the answer is yes, pregnancy centers are covered by these standards. This is what your copy of OSHA's reply to the pregnancy centers question should look like. So you should either have this in a clickable link or have received a packet, or you may have printed it yourself. Here is a brief outline of what we're covering today. OSHA's bloodborne pathogen standard, bloodborne pathogen diseases and their transmission, how to recognize a potential exposure, an explanation of the exposure control plan, methods for preventing or reducing exposure, which we'll be going into detail about there, and hazard communications. All of the requirements of OSHA's bloodborne pathogen standard can be found in Title 29 of the Code of Federal Regulations at 29 CFR 1910.1030. This is what the OSHA fact sheet should look like, as you can see for your own copy. This gives you an overall idea of what OSHA's bloodborne pathogen standard is covering. So what is a bloodborne pathogen? They are microorganisms such as viruses or bacteria that are present in human blood and that can cause disease in humans. These pathogens include, but are not limited to, hepatitis B, HBV, hepatitis C, HCV, human immunodeficiency virus, HIV, malaria, brucellosis, syphilis, and West Nile virus. OPIM. In addition to human blood, bloodborne pathogens can also be found in other potentially infectious materials, including the following bodily fluids, especially because of their potential to be contaminated with blood. Blood products such as plasma or serum, saliva, especially in such as dental procedures, semen, vaginal secretions, skin tissue and or cell cultures, any other bodily fluid that is visibly contaminated with blood. The following body fluids are not expected to be infectious sources of bloodborne pathogens unless they are visibly contaminated with blood: vomit, tears, sweat, urine, feces, sputum, nasal secretions. Since you may not always be able to tell whether a bodily fluid has been mixed with blood, it is best to treat all bodily fluids as potentially dangerous. Transmission. Bloodborne pathogens can be transmitted when infectious blood or other potentially infectious material is introduced into the bloodstream of a person. Transmission of bloodborne pathogens in the workplace can occur through infected blood or OPIM being introduced through non-intact skin such as acne, scratches, cuts, bites, blisters, or wounds, contact with mucous membranes found in the eye, nose, or mouth, or contaminated sharps needle injuries. How to recognize a potential exposure to bloodborne pathogen or other potentially infectious material. As you see in this picture, losing this much blood wouldn't kill you. As you can see, is a small amount, but receiving this much could. 1 milliliter of blood can contain over 100 million infectious doses of hepatitis B virus. Let's go over some examples of possible exposure. Let's say you have a cut on your hand and the cup of urine that your client has set on the toilet lid has now spilled over and has spilled directly on your cut, or even if it has splashed into your eyes or your mouth. That's a potential exposure. Let's say, what if you noticed that after praying with your client and you were holding her hands that you see visible blood on her hand, or that she might have acne that's oozing and she has touched it and now you have touched your eyes or mouth or your cut, and that would be an exposure. What about if you're sorting through laundry or donated clothes and one of the clothes in there has a safety pin that's opened that has now poked you and you're bleeding and your hands have gone through a ton of laundry that have unknown stains on it, and it could be dried vomit, it could be urine. We do not know exactly how long every single bloodborne pathogen remains alive when it's outside of the body. So this would be a potential to be exposed to a bloodborne pathogen or other. Even changing a diaper without gloves, while you have an open wound on your hand. These are all examples of exposures. There are many bloodborne pathogen diseases, but the top 3 are hepatitis C, hepatitis B, and human immunodeficiency virus. Hepatitis C, HCV. Notice my 2 pictures that I found on the internet there. That's what a microscopic view of what the virus looks like, and the bottom there is from Giant Microbes that I would love to purchase one day because they have so many critters that are tangible that you can pick up and show people as you're explaining. But back to hepatitis C. It is the most common chronic bloodborne pathogen infection in the United States. It may lead to chronic liver disease and death. It is the leading cause of liver transplantation in the United States. The symptoms would include fatigue, jaundice, loss of appetite, abdominal pain, intermittent nausea, and vomiting. The treatment involves that there are no broadly available treatments. No vaccine is available. Hepatitis B, HBV. It is very durable and can survive for at least 1 week in dried blood. It's 100 times more contagious than HIV. Symptoms can occur 1 to 9 months after exposure. It may lead to chronic liver disease and death. A small percentage of cases are fatal. The symptoms are the same as that of hepatitis C or HCV. Fatigue, jaundice, as you can see here in the middle picture, is a symptom of jaundice. Loss of appetite, abdominal pain, intermittent nausea, meaning that one feels nauseated off and on, and actual vomiting. The treatment, there's been a vaccine available since 1982 for adults. Human immunodeficiency virus, HIV. It is very fragile and can only survive for a few hours in a dry environment. It attacks the human immune system. Most that are infected with HIV eventually develop AIDS. The incubation period is approximately 10 to 12 years. Many have no symptoms, and some might have mild flu-like symptoms. There are limited treatments, there is no cure, and there is no vaccine available yet. This is an explanation of the exposure control plan. OSHA requires employers to develop a written exposure control plan as part of its bloodborne pathogen standard. It is a site-specific plan which lays out strategies to eliminate or minimize employee exposure to potentially infectious blood or OPIM. The exposure control plan must identify and document job classifications where occupational exposure to blood and OPIM can occur. Some strategies included are universal precautions, engineering controls, work practice controls, and personal protective equipment. You may find the binder that is labeled ECP and is white in the cabinet above the sink in the ultrasound room when it's completed in its entirety. Here is an excerpt from PRCE Exposure Control Plan. It is the Employee Occupational Exposure Determination. As you can see, there are two sections there. One is regular occupational exposure to bloodborne pathogens, and the other is occasional occupational exposure to bloodborne pathogens. So, the following tasks performed could involve regular occupational exposure, which are ultrasound exams, cleaning exam tables, and cleaning the transvaginal ultrasound probe. And these above tasks, if they're performed by these types of employees or volunteers with the following job classifications and descriptions: the nurse, the sonographer, the cleaning personnel who handle red bags, and medical waste disposal. Under the occasional occupational exposure, these are the following tasks performed. 1. Monitoring self-administered pregnancy test. 2. Cleaning restrooms after pregnancy test. 3. Attending vaginal ultrasound exams. 4. Cleaning up after vomit or dirty diapers. And 5. Sorting through clothing donations. The above listed tasks are performed by employees or volunteers with the following job classifications or descriptions and or titles: client advocate, receptionist, child care provider, clothing sorter. So this exposure determination has been adopted for use in this facility after careful consideration of all employee and volunteer duties, tasks, procedures, and all work areas. It shall be updated as is appropriate and reviewed at least annually. Methods for preventing and reducing exposure. We're going to go over engineering and work practice controls, universal precautions, proper hand washing, personal protective equipment, hepatitis B vaccine, response to emergencies involving bloodborne pathogens or OPIM, and how to handle exposure incidents, post-exposure evaluation and follow-up program, signs, labels, and color coding. Here are some of the engineering and work practice controls at PRCE. For engineering, hand washing stations are located in both pregnancy test restrooms, the ultrasound room, the work room, and kitchen, and they're all stocked with antimicrobial hand soap. The gas system must be used after each transvaginal ultrasound. Some work practice controls include always using universal precautions. Always ask the client to wash her hands after she performs her pregnancy test. Gloves are located in each pregnancy test restroom and are to be used at all times while cleaning restrooms after pregnancy tests and while sorting through donated clothes. Hands are to be washed immediately after taking off gloves. Proper disinfectant should be used to clean the pregnancy test restrooms. Exam gloves should be worn while performing ultrasounds. Proper disinfectant should be used to clean ultrasound abdominal probe, exam table, pillow, sink counter, sink, and sink faucets. Use hand sanitizer often. Never bring in or allow food or drink in the pregnancy test restrooms. Use the proper glove removal technique when taking off gloves. We will cover that in just a moment. For universal precautions, this information is directly from the OSHA.gov website. Universal precautions is an approach to infection control to treat all human blood and certain human body fluids as if they were known to be infectious for HIV, HBV, and other bloodborne pathogens. It requires that employees observe universal precautions to prevent contact with blood and other potentially infectious materials. Under circumstances in which differentiation between body fluid types is difficult or impossible, all body fluids shall be considered potentially infectious materials. Treat all blood and other potentially infectious materials with appropriate precautions, such as using gloves, masks, and gowns if blood or OPIM exposure is anticipated. Use engineering and work practice controls to limit that exposure. Please click on this link to watch a video from CDC about proper hand washing. This ends part 1 of the video. Now you may begin part 2.